Now that your child has been diagnosed with asthma, you probably have a lot of questions. It is important that you understand asthma so that you can help your child to avoid future attacks at home and at school. In this video, we will answer the following questions. What is asthma? What are the signs and symptoms of asthma? What triggers asthma symptoms to occur? What medications are used to prevent and treat asthma attacks? How do I administer the asthma medications? What is my child's asthma action plan?
What is asthma?
Asthma is a chronic or long-term lung disease that leads to swelling and narrowing of the airways. Airways are tubes that carry air into and out of your lungs. People who have asthma have very sensitive airways that react strongly to certain substances that are breathed in, causing a flare-up or an asthma attack.
What is an asthma flare-up or attack? Why does it happen?
A flare-up or attack happens when you are around certain substances that irritate your airways. During an asthma flare-up or attack, the muscles around the airways tighten. The inside of the airways gets smaller and begin to swell up. This is called edema. Your child's lungs start making more mucus. Mucus is a thick, gummy liquid that occupies space in the tubes, making the airway space even narrower. It becomes very hard to breathe. Your child will begin to cough and wheeze. Unfortunately, asthma cannot be cured, but by avoiding asthma triggers and using the controller medication daily, you can keep the airways open and your child can breathe normally. If you follow your asthma action plan, your child can live a normal, active life.
What are the signs and symptoms of asthma?
It is important that you be able to recognize the signs and symptoms of asthma so that you can help your child by giving the proper medication or seeking medical attention. Signs and symptoms include wheezing. Wheezing is the whistling noise you hear during breathing when your child's airways are narrowed. Shortness of breath. Shortness of breath is when your child is taking quick, shallow breaths and can't seem to catch his or her breath. Coughing. Coughing will happen most often in the morning or at night. Tightness in the chest. Your child may tell you that his or her chest hurts or feels very heavy. Your child may have one or all of these symptoms. By actively avoiding triggers that cause asthma to flare up, you can decrease the risk of your child experiencing these symptoms.
What are the triggers that cause asthma symptoms to occur?
Roaches. Smoke. Molds and mildew. Pollen. House dust. Furry pets and animal dander. Stuffed toys. Exercise. Strong odors. Colds. Weather change. It is important to avoid these triggers so that your child can lead a normal life. Do your best to avoid them at home, at school, and at friends and family members' homes.
What is the peak flow meter?
The peak flow meter is a device that tells you how well your child is breathing. It takes practice to use the peak flow meter correctly. It is important to keep a record of the peak flow readings daily so you can tell when a change in your child's breathing occurs. When the peak flow meter is used the right way, it can tell you how well your child's asthma is being taken care of.
How do you use the peak flow meter?
You should measure peak flow 2 times every day, once in the morning when your child wakes up, and once at night before bed. Write the peak flow numbers down in a notebook. To start, make sure the red marker is on 0. Have your child sit up straight or stand up. Keep fingers around the meter and not on the numbers. Your child should take a deep breath with mouth open and quickly close their lips around the mouthpiece. Do not put your tongue in the hole. Have your child blow out once, as fast and hard as they can. Blow out only 1 time. Take the meter out of your child's mouth and look at the number. Mark the number on your peak flow notebook. Repeat this 3 times and circle the highest number you reach in the notebook.
What medications are used to prevent and treat asthma attacks?
There are 2 types of asthma medicines, controllers and quick relievers. Control medicines, also called controllers, must be taken each day, even if your child feels okay. Controllers help keep asthma under control and reduce symptoms and flare-ups over a period of time. They work by reducing the amount of airway swelling and mucus production in your child's lungs. Improvement will be seen slowly over time. Controllers should be taken every day, morning and night, before your child brushes his or her teeth. Quick relief medicines, also called rescue medication. Quick relievers help stop an asthma flare-up once it has begun. You will know an asthma flare-up has begun when your child starts to cough, wheeze, peak flow has dropped, or they have trouble breathing. Rescue medications work fast to open the airways by relaxing the airway muscles that tighten during an attack. Relief should be seen within 30 minutes of administering a quick reliever. Your child may have to take quick relief medicine before exercise. Always keep these medicines with you everywhere you go, in case you need to use them. If you need to use the quick relief medicine more than the doctor told you, call your doctor. Your child's asthma might not be under control yet, and you may need to change medicines. Remember, the controller must be taken each day at morning and at night, even if your child feels okay. You should always keep your asthma medicines with you wherever you go, especially your quick relief medicine.
How do I administer the asthma medications?
A canister containing the medicine sits inside of a device called an inhaler. The inhaler will spray a puff of medicine out of the mouthpiece of the inhaler. Your inhaler will fit into the end of a spacer mask. It is important to use your spacer mask with your inhaler. To start, have your child stand up straight, just like they did for the peak flow meter reading. Shake the inhaler. Insert the inhaler into the slot at the end of the spacer mask. Seal the spacer mask firmly over your child's nose and mouth. To administer, spray 1 puff of medicine. Hold the spacer mask firmly over your child's nose and mouth while they take 5 to 6 breaths. The breaths should be slow and deep. If possible, have your child breathe in and count to 10 before the next breath. Make sure you administer the number of puffs that your doctor prescribed. Your child must rinse his or her mouth with water and spit it out after taking the controller. Do not let them swallow after rinsing. Your doctor or therapist will talk to you more about your specific controller medication and about your quick reliever medication.
How do I clean the asthma inhaler?
Clean the mouthpiece and spacer mask with soap and water or in the dishwasher as needed. Rinse only with sterile water, water that has been boiled for 15 minutes. Do not rinse with tap water. Be sure to let it dry completely before use.
What is an asthma action plan?
Your asthma action plan lets you know what medicines to take, when to take them, how much to take, and when to get help. Your doctor and your therapist will work together to develop your child's asthma action plan. They will give you a sheet to take home that describes the asthma plan.
How do you use the asthma action plan?
There are 3 zones. Each zone has a range for your child's peak flows, symptoms to watch for, a list of the medicines and how much of the medicine your child is supposed to take. Your asthma action plan also has your doctor's phone number and the date your asthma plan was written, emergency name and contact phone number. Remember, bring this sheet every time you see the doctor. Let's take a closer look at each of the 3 zones. Green. Your child's breathing is good. No coughing or wheezing. Peak flow is in the green zone. Use the controller medicine as your child's doctor has prescribed. Yellow. Your child's asthma is acting up. There are some problems breathing. Your child is coughing, wheezing, tight-chested, or waking up at night. Peak flow is in the yellow zone. Use the quick relief medicine as suggested. Red. Your child's asthma is out of control. Your child is anxious or worried, with lots of problems breathing, and they are getting worse instead of better. Peak flow is in the red zone. Use the rescue medication as described and seek medical attention as soon as possible. Everyone needs an asthma action plan before they leave the hospital. Questions? Be sure to ask your therapist or your doctor if you have any questions about your child's asthma action plan.
That was a lot of information. Let's do a quick review.
Asthma is a long-term lung disease in which your airways are very sensitive. People who have asthma are sensitive to things they inhale or breathe in. Asthma triggers cause the airways to narrow, resulting in wheezing, coughing, shortness of breath, and tightness in the chest. Asthma triggers that you should avoid include roaches, smoke, molds and mildew, pollen, house dust, furry pets and animal dander, stuffed toys, exercise, strong odors, colds, weather change. There are 2 types of asthma medicines: controllers, which must be taken every day, morning and night, and quick relievers, which help stop an asthma flare-up once it's begun. It is important to keep these medicines with you at all times, especially your quick reliever medicine. The peak flow meter is a device that tells you how well your child is breathing. Measure peak flow twice a day, once when your child wakes up and once before going to bed. Write down the peak flow number in a notebook and use it to determine which zone your child is in for your asthma action plan. Your asthma action plan lets you know what medicines to take, when to take them, how much to take, and when to get help. There are 3 zones: green, yellow, and red.